City Council Public Health team since August this year.
Thank you. We're going to be recording this webinar so that other people who maybe couldn't come today can come at a later time. So welcome to you all. I'm going to talk a bit about housekeeping. Ramez and I will keep our cameras on while we're speaking. When we're not speaking, we'll turn cameras off. And if you could mute your microphones and turn cameras off, but please use the chat function on the right-hand side of the online Teams meeting so that you can leave messages and we'll respond to those further down the line. Ramez, is there anything else that we want to say at this time? You're going to start talking, aren't you, shortly?
Yes, I don't think there's anything else.
Okay. So over to you.
Perfect. What I'll do is I will share this. I'll share the presentation. Just say if you can see the presentation.
I can see that.
Perfect. All right. I'm ready to start.
Okay, proceed.
Hi, everyone. So as I said before, my name is Ramiz. I am one of the sports and exercise medicine doctors here. I work in Birmingham. And today we're going to be talking about physical activity health in South Asian communities in Birmingham. Before we start, I thought let's just outline what I'm going to talk about. So today we're going to talk about the benefits of physical activity and why physical activity is important. Focus will be on the South Asian community to see where we stand compared to the rest of the population and what can be done to make things better. We're going to increase the understanding of the evidence behind the benefits of physical activity and raise awareness of certain local facilities that are available in Birmingham if we're not aware of what they are. So before I start, I thought we'll just define what South Asian communities mean. So when I looked online, there were varying definitions for South Asian community, but the main 7 countries that came up on all my search was India, Pakistan, Bangladesh, Sri Lanka, Maldives, Bhutan, and Nepal, which estimate with an estimated population of 1.94 billion people, with India being one of the largest countries in the South Asian community. This slide here, I'm just here to talk a little bit about ethnicity and race and the percentage of South Asians in Birmingham. Ethnicity is more of something self-defined and is something that can change over time, whereas race is legally protected characteristic and it's being part of a group of people who are identified by their nationality, citizenship, color, or ethnic origins. Now, Birmingham, when you look at Birmingham, 48.6% of Birmingham is populated by white British people, and the second most common one is South Asians, which represent 31% of the population. And out of that 31% of Asians in Birmingham, 55% are represented by Pakistanis or British Pakistanis, followed by Indians and then Bangladeshis. So as you can see, we've got quite a large number of Asians living in Birmingham. So therefore, we're focusing currently on this group of communities. So before we talk a little bit more about physical activity and its guidelines, I would like to know who's familiar with how many of you are unfamiliar with this Chief Medical Officer's physical activity guidelines. I think Linda has already posted a QR code or code number on the chat. So it would be great if all of you can.
Have you got the number as well, Ramez? Because I haven't got the number. It was in your presentation.
Yes, it's 3110.
Okay. 3110, yeah.
5518.
Okay, I'll post that.
This talk is very interactive and I would like as many people to participate as possible. You can use your mobile phones, so you can simultaneously listen to the presentation on your laptop or computer and answer the questions on your phone as well.
Was it 3110-5518?
Yeah, that's correct. Yeah.
Great.
We've only got one person who signed up for it yet.
We've got 6 people on the call and 2 of them are you and I, so we only need 4.
You only need 4 people. One more person. It'll be, and it's all anonymous, so you don't have to worry about what your answers are going to be. I'm not going to find out. No one's going to find out the answers. What do you say? Great. I think we've got all 4 of us who have.
Great.
So there's one person who hasn't heard of it and 2 of it heard of it but unfamiliar. Okay, that's a good place to start with. So I wanted to delve into the important distinction between physical activity and exercise. They both are 2 completely different terms. Whilst they both involve movement and exertion, they have different characteristics. First, physical activity includes any bodily movement produced by skeletal muscles, that is, your muscles of your hands, back, your core muscles, and your lower leg muscles, and it requires energy expenditure. Now, in simple terms, what this means is it's all the movements that you make throughout your day, from walking to taking the stairs to walking your dog. It's not necessarily planned or structured, it's just part of your daily life. Whereas exercise is more of a specific and deliberate form of physical activity. It's planned, it's structured, repetitive, and purposeful. This means that you intentionally set aside time for structured movement, like activities like jogging, weightlifting, or yoga. Both of them have a place in maintaining a healthy lifestyle, and understanding this distinction can help you make more informed choices about your physical well-being. Now, physical inactivity means you have less than 30 minutes of moderate intensity physical activity per week. I'll come to the point what I mean when I say moderate, because I'll be using the term moderate quite a bit in this presentation today. So we will define what moderate intensity physical activity means in the next couple of slides. So as I said, the question was how much physical activity is needed. So it varies so we can divide this into 2 groups. So we've got adults between 19 to 64 years of age, and then we've got children between 5 to 18 years of age. Now, the physical activity, the Chief Medical Officer's guidelines are a set of guidelines that are there for people to do exercise, but it's not something that, so what it is you've got to aim for at least 30 minutes of moderate activity exercise 5 days a week. Alongside that, you've got to do 2 days of strengthening exercises that work up all your major muscle groups. And you have to reduce the time that you spend sitting or lying down, or breaking up your periods of not moving. So that's what the essential guidelines are. Now, you can either do 30 minutes of 5 days of moderate activity 5 days a week, or you can have vigorous exercise 75 minutes throughout the week. Now, although these are set guidelines for people to do, this is not what you're supposed to start off with and be at this point already. We understand that it's very difficult for people to spend 30 minutes of moderate intensity exercise 5 days a week. It's something, as I said, you should aim to do this. So it's a build up that you can do over every few days, every few weeks, and the aim should be to get to that level. Now, some people might not be able to get to that level, which is still better. It's better to do something than doing nothing at all, and that's what the guidelines are trying to say. Basically, to aim to get to 30 minutes a day. That is for adults, whereas for children, it's slightly more, where you have to aim for at least 60 minutes of exercise per day throughout the week. That in 7 days a week. What my main point here is to focus on is, yes, although we have to do 30 minutes 5 days a week of exercise, 5 days per week, you don't have to get to that level. It's better, it's more beneficial if you get to that level, and you should aim to get to that, but even a little bit every day is beneficial for everyone. So as I said, we're going to talk about what the definitions of each of these. So let's start off with, can I ask you guys to go back onto Menti and answer this question. Out of all the 4 options that I've given you, what do you consider light intensity physical activity? Linda, have you got any other people who signed up?
No, we're still on 6.
Still
So
on
it's
6,
4
okay.
people and you and I.
So that's interesting. Everyone thinks walking is light intensity physical activity. Have you got the answer for it there, or does it not show the answer?
No, it doesn't show the answer.
It doesn't show the answer. Okay, fine. So I'll come back to this slide again. Interestingly, walking is not considered light intensity. Walking is actually considered moderate intensity physical activity. What's considered light is carrying out rubbish or carrying out light shopping from your house to the garden or something. That's considered light intensity, because walking is a lot more moderate intensity than light. I've answered the question already for you guys. So what is considered moderate intensity physical activity? Yeah, I've given you guys all the answer now. So there you go. What is considered severe intensity physical activity? Okay. Again, weight exercise is considered very severe. So that's very vigorous intensity. So more towards swimming. Swimming is an example of something which is more severe than weight exercise. So this little picture here, image, is actually a good example of what is considered different intensities of exercises. Now, as you can see, as the intensity of each of these exercises increases, your heart rate increases, your breathing rate increases, and the energy consumed also increases further. So sedentary, as you can see, sedentary is basically not moving at all or sitting at home or working in a desk, whereas light exercise is considered carrying out rubbish, yoga, or cleaning in the house. Whereas moderate intensity exercise, examples of moderate intensity is walking, cycling, or shopping. Vigorous is swimming, playing football, dancing, playing badminton is considered vigorous. And very vigorous kind of exercises are where you're doing weightlifting, sprinting up hills, or body weight exercises. They're considered more very vigorous. So a lot of people think walking is a light intensity exercise, but actually it isn't. It's considered more moderate type exercise, which is what the guidelines actually state, that you need to do at least 30 minutes a day of this if possible. And it's very achievable. A lot of people think doing exercise 30 minutes a day is difficult, but if you consider what is considered moderate, it is quite achievable. And another way of finding out whether you are doing moderate intensity exercise or you're doing vigorous kind of exercise is your subjective perception of breathing and talking. So, for example, if you're doing moderate intensity activity, you can talk, but you can't sing during that activity. So you can hold a conversation with the other person, but you can't sing. Whereas a vigorous type of activity is when you're not even able to say a few words with your partner if you're training with. Now, this is a fantastic resource that was released by the World Health Organization. And this graph shows you on the x-axis the minutes of physical activity you do per week, and the y-axis shows you the benefits of health. Essentially, what this graph shows you is that the more exercise you do per week, the benefits of it increases, and the sweet spot is where you achieve the most benefit between 150 to 300 minutes per week. But as you can see right at the left hand screen of the graph, where it says sedentary, you have no benefit at all. Even if you do 50 minutes per week, there's still more benefit than not moving at all. So doing some physical activity is better than doing none. And that's what the World Health Organization is trying to show. So some great reasons to get active. Now, there's a misconception that physical activity is important for weight loss, and that's what a lot of people associate physical activity with. But actually, research has shown us that physical activity doesn't actually help you in losing weight. It just helps you maintain the weight that you're at. What actually helps you reduce weight is your dietary changes. So physical activity actually has got more other better benefits, and it's got physical health benefits and mental health benefits as well. Being physically inactive is now known to be the fourth largest cause of death in the world for after conditions such as diabetes. So what being more physically active means is it helps you reduce the risk of having major illnesses such as type 2 diabetes, high blood pressure, heart problems, problems with the circulatory system of your body. It helps to improve your blood glucose and insulin sensitivity. The other advantage of being physically active is that it reduces your risk of early death by 30%. And being more physically active also basically means you're being physically active means you're getting stronger and you're able to control yourself. You got better cognition, and it also reduces the risk of you having falls. Less falls means less chances of you having fractures and hurting yourself. As I said, physical activity doesn't only help with physical health, but it also actually helps with mental health. For example, it reduces the likelihood of depression, and it can also be used as a form of treatment for depression, because one, the more exercise, the more physically active you are, it increases the happy hormones in your body, which helps to reduce the likelihood of depression. And also, a lot of people, when they are physically active, they hang around with people who are more physically active. So there's a lot more for social aspect of being physically active, and that makes things a lot better and reduces the likelihood of depression, or even helps you overcome depression. And there are loads of other great reasons why people should be physically active, and there are not many disadvantages to being physically active. You can always speak to your GP or contact any other healthcare professional, and you can get a lot of advice regarding why physical activity is actually important. As I said, today we're just focusing a little bit on the South Asian community as there's a huge population in Birmingham. And I've got two charts here, one on the left, which shows the general activity levels of Birmingham. And then the right, it shows you specifically Asians, and this excludes Chinese people. So as you can see, the data is up till November 2021 to 2022. So the general population in Birmingham, the physical activity who reach the physical activity level of at least 150 minutes a week is 54.9%, whereas in the South Asians, it's lower, standing at 48.2%. And the level of physically inactive people in general in Birmingham is 33%, whereas South Asians are a lot more at 38%. Although the differences are there's only a slight difference between the two groups. The concerning trend here is looking at where it's been in November 15 to November 2021, where the trend has gone down from 58.4% to 48.2. So rather than having an increase or improvement in people being more physically active, the South Asians are actually going in a downward trend where they're less active than they should be, which is quite concerning, as we've been encouraging people to be a lot more active over the last few years, and we're not seeing this improvement in the South Asian trend. I've got a few pictures here from the Global Physical Activity country cards, which shows the prevalence of physical activity in South Asians in compared to their counterparts in countries like India, Pakistan, and Bangladesh. As you can see on the left, there's a little table there which shows that now we know in Birmingham the South Asians are only 48.2% of them are active, whereas if you look at the physical activity prevalence in India, it's 66%. And now if you compare that to Pakistan, which is also 66%, which is quite significantly higher than what we've got here in Birmingham. Bangladesh is a lot more at 72%. As you can see, that's a lot more there. That's something I found quite interesting, that our counterparts in countries such as India, Pakistan, Bangladesh, they're a lot more active than the same South Asians who live here in Birmingham. So my next question to you all is, why do you think there's a difference in prevalence in being active in South Asia compared to England? If you could just give me a few answers as to why do you think that is the case?
Is there less reliance on transport and they're more walking?
Yeah, true. Anyone else? Transport mode, weather, type of work. Spot on, spot on. I think that's manual jobs. Yeah. No, yeah, I think that's spot on actually. So what I found from my research was jobs in South Asia, they're more physically active, as you can see. Some of the pictures that I posted up here. Better climate and environment. So the jobs there, you can more outdoor jobs available, a lot more farmers working in South Asian countries, which contributes to why they're more physically active, and unknowingly they reach the WHO guidelines of being physically active. Now, interestingly, they follow the same guidelines as we follow, that is minimum of 150 minutes per week of moderate intensity activity or 75 minutes of vigorous activity. This is set by World Health Organization. The other thing is migration. We think that people who move from South Asian countries to England, they find they change depending on what people do here. But there's still more research that's needed to find out exactly what's the main difference are. But those are the kind of differences we think that we found from our research. Another question for you all is if you could just write down some points to me to say what do you think are the common barriers to people being more physically active here in Birmingham or generally? Confidence, yeah. Weather. Yeah. TV. Yeah, being judged. Careers. It's always the same, it's common barriers. So that's you're right. So potential barriers to being regular physical activity, mainly in the South Asian population, I found was they found time constraints, work commitments. There's a cultural emphasis on being more academic or having professional achievements or being physically active. Lack of access to convenient exercise facilities are some of them. Some of them have lack of awareness of importance of physical activity, and their traditional dietary habits play a huge part in not being physically active. So these are potential barriers which we thought we came across when people were being due to lack of being active, physically active. So what do you think are ways that we can do to improve and be more active and getting people more active? Simple question, to be fair. I'm hoping this talk today is raising awareness for people. So we're trying to raise awareness of what they can do to be more physically active. And we've also, I've got another couple of slides later on, which talks about local facilities that are available for people to be more physically active. Yeah, I agree. Single sex groups, they work because a lot of South Asians are from a Pakistani background and Muslims, and they like to be with single sex groups only when it comes to classes, physical activity. So, so a lot of people, there's a misconception that being physically active is going to the gym for exercising or going for a run, and that's actually not true. being physically active, as I said, was simple, and it's trying to incorporate it into simple activities. So, for example, walking from one place to another place rather than taking public transport, if possible, or rather than taking cars, but it's either walking or getting a bicycle and start cycling from places A to B. We've got a lot of mosques there, Muslims there, Sikhs, who can, rather than driving to their religious places, they can start walking to their religious places if they have to pray. Shopping, lifting items more, going for shopping, and even exercise, physical activity can be done at home. It doesn't have to be at the gym. You can use resistant bands. You can be doing exercise, stretching, yoga. These are all forms of physical activities that can be done to help people get more active. It's just about finding ways of what you can do to be more physically active, and thinking, sit down, have a think about, okay, this is what I do in my everyday. So, for example, commuting to work. So rather than taking the car, if you work a few minutes away, see if the weather is nice, you can you can walk to work. So there are loads of ways you can improve to get be more physically active. So now these are certain resources that are available that, as I said, if people wanted to get physically active more, and you can go and join these groups. You've got the Active Parks Birmingham, which have free physical activity sessions in 80 parks. There are women's walking groups only in Lozells. There are women-only fencing groups, women-only swimming groups, group classes, gym sessions for Birmingham residents in leisure centres. You get access to, so there's the Be Active group where you get 1 hour of free access to the gym for these in specific leisure centres, which you can find out by clicking on that link. And I'm hoping these slides get shared to all of you. There's kids badminton between the ages of 7 to 12 years of age at Lozells again, where people can get help for further being more physically active. And other useful links that are available are, if you go onto Sport Birmingham, or you go onto Birmingham City Council and click on Every Movement Counts, you can find local specific activities which are available in Birmingham that are free and also for paid activities. So it's quite a useful link for people to get access to. So in the Birmingham City Council has been working on trying to encourage the South Asian population communities by being more physically active. And what we've been working on is a few culturally competent toolkits, and we've got a little video which I'd like to share with all of you about how we are trying to. This currently is in Urdu, but we're also getting we've also got other languages to focus to show you guys, which are on the website, on how to promote physical activity in different South Asian communities. What I'm going to do is I'm just going to stop sharing my screen for a minute and play this video for all of you. Sorry, 1 second. I'm still share this, include computer sound, Windows. There we go. Can you all see this?
Yes, I can see it.
Yeah.
वर्जिश क्यों जरूरी है? बहुत से लोगों का ये मानना है कि जब तक कि वो किसी मसरूफ मुलाजमत या तर्ज जिंदगी का हिस्सा हैं, उन्हें वर्जिश करने की जरूरत नहीं। लेकिन सेहत और तवील उम्री के लिए जिस्मानी सरगर्मी जरूरी है। क्या आपको मालूम है कि इंग्लैंड में सिर्फ 62% अफराद ही जिस्मानी सरगर्मी की हफ्तावार रहनुमा हिदायत पर अमल पैरा हैं। ये तादाद एशियाई कम्युनिटीज में और भी कम है, जहां सिर्फ 55% लोग चीफ मेडिकल ऑफिसर की वर्जिश के हवाले से रहनुमा हिदायत पर अमल पैरा हैं। बेम कम्युनिटी से ताल्लुक रखने वाले अफराद का ज़्यादतीस 2 में मुब्तला होने का इम्कान 2 से 4 गुना ज्यादा होता है, और ज़्यादतीस दिल की बीमारी के हवाले से आपको लाहक खतरात को दुगना करती है। अब इसके हवाले से कुछ कर गुजरने का वक्त है। बालिगान को हफ्ते में 5 दिन 30 मिनट तक दरमियानी दर्जे की सरगर्मी अंजाम देने का हदफ अपनाना चाहिए। हफ्ते में 2 मरतबा ताकतवर सरगर्मियां अंजाम देना तमाम बड़े उजलाती ग्रुप्स के लिए मुफीद होगा। ये आपके दिल की बीमारी या स्ट्रोक के खतरे को कम कर सकता है और आप इसकी वजह से ज्यादा मजबूत महसूस कर सकते हैं। ये सिर्फ दौड़ने जैसी कार्डियो वर्जिशों के मुतालिक नहीं है। रक्स करना, घास काटने वाली मशीन चलाना और भारी भरकम शॉपिंग बैग्स उठाना भी आपके रोजाना के अहदाफ में शुमार होते हैं।
So this was one of the tools that we've been using because we understand like language barrier can be an issue trying to encourage people to be more physically active South Asian populations. So hence we've got in different languages so people can understand things better. What we're also trying to do is not just encouraging by using these kind of toolkits, but we've also been speaking to different religious leaders because we understand people from different religious backgrounds would like listen to their leaders more. So we've been trying to contact other leaders. So at the moment, I've got a little video clip which I'd like to play for all of you from one of the Muslim leaders here in Birmingham. And let me share that with you guys. It's a bit long video. We've got time, so I just thought I'd play this with just about 4 minutes. So this is what we've been working on. So we've got one of the Islamic leaders here in Birmingham to give a talk to the general population here in Birmingham to encourage physical activity and trying to use religion as a form of how important being physically active is. We've been working with other religious leaders. We've been trying to get hold of other religious leaders as well, but at the moment we've only got a Muslim leader.
Ramiz, I think you need to share video sound because it's not coming through.
Is the sound not coming through? Okay,
No.
let me see what's happened here.
And assalamu alaikum wa rahmatullahi ta'ala wa
Is that working now?
Yep.
Perfect.
barakatuh. Today I want to discuss with you a very, very important topic, and this is the topic of good health. In our society, and especially in Birmingham, as a Muslim community, we find ourselves falling below the good health targets. However, as a community, if we come together and as a community, if we follow some of the simple teachings and rulings of Islam, then we can definitely overcome this challenge. One of the beautiful things about following an Islamic principle, especially that principle which promotes good health, not only gives us physical benefits, but it also gives us spiritual benefits. And combined, we find ourselves to be happier, we find our families to be happier, and fundamentally, we find our communities to be happier. 3 principles that I want to bring to your attention. The first and foremost is the context of this notion that Allah subhanahu wa ta'ala has given you and I this body as something that's an asset that's entrusted to you as an amana. It is my duty, it is your duty, it is our duty to look after this. Simple way to look at it is just the way a car needs good health checks, it needs good fuel. Our body is exactly the same. For us to be in the best physical ability in order to perform and worship Allah correctly, we also need to ensure that what goes inside our body is cognizant and is what reminds us that Allah subhanahu wa ta'ala has entrusted this body as an amana, as something that's entrusted to you as our special asset. And the second thing is that you and I need to promote good health. We need to recognize that not only is it an act that's beneficial to you and I, but it is something that the Messenger sallallahu alaihi wasallam would often promote. He would promote good health, which then led to the prevention and also the cure of illness, of all forms of disease. And finally, he would encourage the improved sleep. Sleep is important, managing our diet is important, managing our health and well-being is just as important. And the third and the final thing is if we follow some basic etiquette and some basic principles of Islam, with the mindset of good health, then we can find ourselves walking and leaping towards success. The first thing that Islam promotes is regular salah. Salah is a regular daily bodily exercise. So remember, when you perform your salah, if you do it consistently and often, then you automatically will be exercising your body. When you talk about food, Ramadan teaches us that once a year we need to have a detoxification of our body, our gut, our health, our stomach. Equally, this also reminds us that we need to be mindful of what we eat. By being mindful of what we eat, we are appreciative of the benefits and the blessings of food from Allah subhanahu wa ta'ala. And finally, having a target, being optimistic about being healthy. Just the way we look forward to the journey of our lifetime, which is Hajj, we also need to look forward to improving our health. And we connect the two by remembering that just like we do in Hajj, we have a huge task of physical exhaustion. We need to be in the best physical ability in order that we can worship Allah subhanahu wa ta'ala within the act of Hajj. And similarly, we need to be constantly in the mindset that we need to be promoting our good health. We need to be improving and finding good health. If we can promote this, not only will we be beneficial spiritually, we will also be beneficial spiritually. May Allah subhanahu wa ta'ala make you, make me, our communities and our families people of good health, and fundamentally may we be amongst the people who look after this beautiful body, this beautiful asset from Allah subhanahu wa ta'ala. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
So that was just a little video we managed to get from one of the Islamic leaders to give a talk on how important physical activity is to everyone, and we're trying to get hold of other religious leaders as well. So this is just a start where we're at. So yeah, so that brings me to the end of this talk today, and I hope at the end of the session I've been able to describe the importance of physical activity, where South Asians stand, and what we can do to improve the South Asian population from getting more physically active. And exercise and physical activity is not just doing exercise at the gym, but any movement, and most movements are considered to be more physically active. And we just and basically, at the end of the thing, what I want you all to take home from this is just remember, every movement matters and every move counts. And it's better to be more active than to be sedentary. And we need this culture to be a norm in everyone. Thank you. I think that's it, really. Thank you for attending this webinar today. I'm just going to stop sharing my screen, and if there are any questions any of you have, you can ask me the questions, or if there's anything on the chat, I'm happy to